Hi there everyone, my name is Ollie and I'm a second year medical student at the University of Warwick. This is going to be the fourth instalment in the Med School Book Club series. And this time I'm here to talk about Being Mortal by Dr. Atul Gawande, a general and endocrine surgeon practicing in the US, and he's actually one of the most successful medical authors of our time by most measures. So this one, Being Mortal, Medicine and What Matters in the End, is the fourth of his books and the most recent release. I think it came out in 2014. But you'll have definitely heard of his other books. They're all bestsellers. The Checklist Manifesto, Better, A Surgeon's Notes on Performance, and Complications, A Surgeon's Notes on an Imperfect Science. It's another kind of slightly uncomfortable book because ultimately Being Mortal is about what it means to grow older and to die. There are a few different medical definitions of aging, but all of them tend to share some common themes. I guess the way I think about it, aging is kind of a genetically predetermined but crucially environmentally modulated process that leads to deteriorating function, increased vulnerability to infection, basically greater susceptibility to death, and I suppose you'd hallmark it by features such as thinning of the skin, decreased mobility and reduced immune function, things like that, but these are all very medical and metric. And the reason I bring this up is that aging is obviously gradually happening to all of us, as well as our loved ones, the people around us, and the way that I read Being Mortal, it's almost a reflection, whether that's maybe the correct word, a meditation almost by Dr. Gawande on what this process actually means for us. At the age of 30, the brain is a 3-pound organ that barely fits inside the skull. By our 70s, grey matter loss leaves almost an inch of spare room. That's why elderly people like my grandfather are so much more prone to cerebral bleeding after a blow to the head. The brain actually rattles around inside. So I'm just going to detach from the book very quickly just to give my own reflection on what I've experienced since coming to medical school, because I think before I got a bit older and before I really had a good idea of what medicine actually was and what it meant, I used to think that the job of doctors was just to prolong life, to make people better. I was aware as a child that obviously there were some situations, if someone had a heart attack, for example, or they were hit by a train or something, that there were some situations that doctors couldn't bring people back from. But most of the time they would just kind of have people living for as long as possible. But as I've gotten a bit older and got to where I am now, and in that time have spent a lot of time around not just elderly patients, but young people as well who are in the process of dying for one reason and another, there are definitely some situations that if they happen to me, I wouldn't want my life prolonging in those situations. You know, things like if I had locked-in syndrome, if I was completely paralyzed, maybe even if the only way to keep me alive was permanently attached to a ventilator. I'm not sure that I'd want that for myself. And basically, as we're taught in medical school now, and I think is the correct way, and most people should be able to arrive at that conclusion, the goal should be simply making sure people's quality of life is as good as possible, however way you want to measure that, not prolonging suffering if it can be avoided, and if people are going to die, making sure they can do it in a humane way. Even just within the first few chapters, we cover the state of our current aging population relative to the aging population of even in the last couple of 100 years. We see a geriatrician who starts to notice signs of his own aging process and has to start doing himself the sorts of techniques that he would have used with his elderly patients when he was practicing. And the case of an 80-year-old man who refused to move from his house of many years, even though it was right next to an erupting volcano. The main thrust in this early part of the book, at least the way I read it, is all about how much control we actually have over what happens to us as we get older. In some cases that's really not a lot, particularly when limited by things like costly medical treatment and lack of support. So just for another quick quote, a 2011 study found that medical spending for a breast cancer patient in the first year of diagnosis averaged an estimated $28,000, the vast majority of it for diagnostic testing, surgery, and where necessary, radiation and chemotherapy. Costs fell after that to about $2,000 a year. For a patient whose cancer proves fatal though, the cost curve is U-shaped, rising towards the end to an average of $94,000, during the last year of life with a metastatic breast cancer. And as strange as it sounds, I actually like that the book begins in this kind of macabre, sombre and unsettling kind of way, because as we move through the midsection, it takes a much more positive turn. We're told about how things have changed in nursing homes and assisted living situations, and the research where bringing things like pets, like animals, bringing children, bringing gardens and things like this into these environments have been shown to significantly improve quality of life for those patients. As well as the idea that simply having something to live for, whether that's something like a religious belief or your family and friends, or even just a hobby, this very simple thing can actually lead to incredibly improved longevity for patients and keep them a lot happier. Without giving away too much about the book, the latter part is all about Dr. Gawande facing one of these situations himself. He has a family member who's inflicted with quite a severe illness and is then facing the reality of death. So Gawande has to go through this supporting that relative and speaking to lots of different doctors. So he's now obviously on the other side of the interaction that he's used to, having to take advice from other people, and we go through the different models of communication between doctor and patient. There's a lot of focus on what degree of honesty doctors are expected to have when talking about death, and I have found that this later part of the book really tied in well with, as I say, what we're taught about how as medical students and doctors of the future we should be interacting with patients, as well as the attitudes towards patient care when it comes to palliative medicine and offering people a humane death without suffering. Now, I was a bit worried when I started this med school book club series that I might subconsciously focus on books that were only interesting to me because I'm interested in medicine, and that would obviously bring down the suitable cohort of people that might find them interesting. However, again, I don't really have any problem in saying that I think Being Mortal carries significant pearls of wisdom that will be useful for anyone really, whether or not you're interested in medicine and healthcare. I'm lucky enough to have not been affected too deeply by the issues that are presented in this book, but I feel like they've prepared me a bit better for the future, the sorts of things I can do to think about how myself and other people might handle these situations. And I'm absolutely sure that many of you maybe watching this video will have dealt with death, either someone in your immediate family, a relative or a friend. And this book might provide some small degree of solace, or at least maybe help you or people out there understand why they've maybe had the types of interactions with doctors that they've had, which could be positive or negative, but I think it gives a really good insight into how normal people deal with the idea of talking about death. And that's where I'm going to wrap for this episode, guys. Thank you very much for watching. Please be sure to hit that like button for me, leave a comment, subscribe to the channel. Don't forget to go and check out PostGradMedic.com for the full written review, as well as a load of other videos just like this. Take care, and I'll see you next time.